My name is Alan Yamataloto and I am affiliated at Bulacan State University. The title of the study is all about unfolding of a new beginning, the meaningful journey of doctorally prepared nurse educators. And I'm sure that some of us here can relate, especially those who are attending the graduate school. For the background, I will start with the background of the study. So professionals from different disciplines seek to attain the topmost accomplishment possible. In nursing, an existence of doctoral programs attests to this movement that is known as Yato to Institute. Now, according to Peak and Nikita, 2011, it is estimated that there is less than 1% of nurses with doctoral degrees, and this underscores the critical need for doctorally prepared nurses who will educate future nurses. They will prepare the nursing workforce to generate evidence for practice that leads to complex health patients. While doctoral preparation may open an array of opportunities for nurses, the challenges associated for earning it cannot be discounted. Empirical evidence suggests that challenges related to PhD process include, but not limited to, dexterity in composing scholastic paper, that is from Gaza et al., maintaining job at the same time schooling, that is from Alice, Zoglu, and Suhon in 2011, among other reasons. Further, the data from the Council of Graduate Schools 2008 indicated that the program attrition rate for doctoral is 40 to 50% on average, and it varies in different disciplines as nurses attend in diverse doctoral fields. On the other hand, there are a number of nurses who have gained doctorate degrees, which equip them benefits such as self-esteem in performing daunting functions and sense of contentment. And it paved the way for favorable circumstances in school, leadership, and management. With current demand in work and competition in the field of nursing, Filipino nurses are increasingly expected to accept the highest nursing educational preparation. However, only few literature reports about the experiences of students taking doctoral nursing degrees in the country. With inadequate literature, it is essential to document the phenomenon as this can be an example. That is from Vasquez 2013. Given the above literature, the logical progression is to investigate the lived experience of nurses who are PhD holders in their pursuit of doctoral philosophy in nursing education. The central question of the study was, what are the lived experiences of PhD graduates in pursuing PhD in nursing education? The study also intended to describe participants' recommendations for supportive practices for optimum. The study utilitative technique descriptive phenomenological research design. This approach was aligned with the study's purpose of phenomenology to elucidate meaning, organization, and significance of experiences of the participants around a specific phenomenon. The participants of the study were graduates of doctor of philosophy in nursing education, students selected by a homogeneous family. The inclusion criteria were first, degree holder of PhD in nursing education, full-time student while attending PhD, and currently employed in school setting or as a nurse practitioner. The study was analyzed manually and utilized analysis method of Van Gaal, which provided specificity in interpreting verbal statements and feasibility for analyzing numerous information. Approval was obtained from how IRB and ethical considerations were observed. For the findings, in the process, the journey of doctorally prepared nurse educators was captured in three major themes. The first major theme, career jumpstart and planned opportunities. It referred to the experiences that most of the participants did not plan to enroll yet were one, all encouraged, two, influenced by their friends, or third, just dread or career progression. The second major theme, sharpening the saw, tales of the learners. Following the initial steps and beginnings of doctoral students in their PhD life are their experiences and faith all throughout journey. It is at this point of their endeavor that can be described as a roller coaster experience because of the challenges and competing priorities. At the same time, generally considered to be positive and meaningful, considering their learnings and bonds with significant people in their journey. It can be further understood by three sub-themes. A, the learning cycle. B, harmonizing responsibilities. C, visible and ulterior push. And finally, the last or third major theme is behind the curtain, the unfolding of a new beginning. This theme embodies the success stories of each of the participants from the beginning of PhD journey until the end. It can be described as life-changing in all aspects, spiritually, socially, mentally, and even more on emotional. Included as significant part of their PhD endeavor are their experiences, realizations, and changes following the completion of doctorate degree. This slide presents the recommendations from the participants. First, PhD graduate mentors to discuss the curriculum with the students on the first day of the class. Second, in terms of learning, it should be more quantitative and incorporate more experiential learning. Third, there should be a training for professors and a serious student-teacher evaluation. Fourth, there should be a curriculum review, and the professors must see to it that all the requirements are workable within the time allotment. Fifth, in dissertation writing, the panel members or heads must be aligned in terms of the degree. And finally, for aspiring PhD students and those who are already in the program, to receive support for their institutions such as scholarship grants. For the conclusion, the meaningful journey of doctorally prepared nurse educators commenced by an unplanned decision to pursue higher education with a goal of career progression at the back of their minds. While in the program, their tales are mostly about their classmates who came from various and diverse backgrounds, their description of the fully imposed adult mode of learning, and their appreciation of actual application of conceptual learning. Towards the end, completing the degree and opening of new opportunities came about. Lastly, for the recommendation, nurse educators are encouraged to pursue continuous education up to PhD level. And even though the undertaking can be challenging, nurses must use applicable strategies to attain the desired graduate. Thirdly, second, PhD students must be cognizant of the challenges and strive to realize the completion of the program. And finally, educators such as graduate school professors, as well as administrators, should be open to innovative models and strategies such as blended learning, consistently create a positive academic environment, and efficient academic coaching program to students in earning the competencies anticipated to them that can promote student success. And that ends my presentation. Thank you for listening, and I'm now over.